most important thing in understanding INO is to understand how absurd the concept of conjugate gaze really is. Your brain does this complex thing without even thinking. Let's ignore the up and down and focus on the side to side. Let's say that Bartlett low at the corner of his left eye and wants to look at him because, come on, Martin Sheen's grandfatherly facade, we'll see that things are actually far more complicated. When Bartlett looks left, his left eye moves to the left. It abducts by moving away from the midline. This requires contraction of the left lateral rectus muscle, which is innervated by the left abducens nerve. Now, you have two eyes for a reason, for depth perception, so you can figure out how far away from you Rob Lowe really is. Bartlett needs his right eye to focus on Rob Lowe as well. The right eye moves to the left, toward the midline. Adduct his right medial rectus muscle. The right medial rectus, remember, is innervated by the right oculomotor nerve. In order to avoid double vision, both these eye movements need to take place simultaneously. The left abducens nerve, which has its nucleus in the left side of the pons, must work the right oculomotor nerve, which has its nucleus in the right side of the midbrain. Two different muscles on opposite sides of the face, innervated by two different nerves on opposite sides of the head, placed in two opposite sides of the brain, working together in perfect harmony. There's a heavily myelinated tract called the medial longitudinal fasciculus that joins them up. On left lateral gaze, the right medial longitudinal fasciculus will allow the left abducens nerve and right oculomotor nerve and move the eyes in a synchronized fashion. So what happens when this goes wrong? So let's imagine that Bartlett's MS is affecting his right medial longitudinal fasciculus. What happens when he tries to look to the left? You can see the left eye abducts successfully, but the right eye is not able to adduct past the midline. Now let's look and see what happens if Rob Lowe paces back and forth across the... You'll see that conjugate gaze is unaffected when gazing to the right. It's only when gazing to the left that conjugate gaze is affected. The right medial longitudinal fasciculus is damaged. Bartlett may also notice some double vision when looking to the left, and you might notice on examination some nystagmus in the abducting eye. It's important to remember that the muscles and nerves themselves are unaffected. If we cover the left eye and take that one out of the equation, the right eye should be able to adduct all by itself. It just doesn't play well with others. You can also get bilateral internuclear ophthalmoplegia if both medial longitudinal fasciculi are affected. This is what that would look like. Unilateral internuclear ophthalmoplegia, remember that the lesion is ipsilateral to the eye that does not adduct. In younger patients, multiple sclerosis is by far a common cause, but in older patients, ischemia can also play a role. If you stumbled across this in your PACES exam, the most useful next test would probably be an MRI head to look for demyelinating plaques, MS, or for ischemic lesions. Visual evoked potentials and a lumbar puncture for oligoclans are other useful tests for multiple sclerosis. I hope that makes a little bit more sense, and more importantly,